Hi everyone. Today in this video let us discuss the combination of Tamsulosin and Dutasteride for the treatment of benign prostatic hyperplasia. In the men with age above 40 or 50, we can commonly observe prostate enlargement, where enlarged prostate can produce various symptoms. Because of increase in its size, it can produce some pressure on the bladder neck, which can increase the urinary urgency. But at the same time, urethral flow is going to be narrowed so that the urinary outflow can be reduced. So in the men with prostate enlargement, we can observe increased urinary urgency, but at the same time urinary flow is reduced, leading to a weak stream of urine and leaky urine. Such condition is called as benign prostatic hyperplasia, BPH. This condition is benign because it is not that much harmful and cancerous in nature, but still it can complicate the lifestyle. That's why the treatment for BPH is very essential, and we have so many types of medications. Among them, Tamsulosin is one of the well-known medication indicated for BPH. Similarly, if you have the other drugs like Dutasteride can also be given. Both of these drugs can be used individually as monotherapy for the treatment of BPH. But in the conditions like moderate to severe BPH, we can use the combination of Dutasteride plus Tamsulosin as a single capsule to relieve the symptoms of BPH. Here both of these drugs are completely different. Dutasteride mainly reduces the size of prostate gland, whereas Tamsulosin is going to increase the urinary flow. But both of these drugs can be combined in a single capsule to relieve the symptoms of BPH. Dutasteride is a 5-alpha reductase inhibitor which can reduce the prostate size, whereas Tamsulosin is a alpha-1A blocker which can increase the urinary flow by relaxation of smooth muscles at the bladder and urethra. So this combination is an effective combination in those patients who are having moderate to severe symptoms of BPH with urinary incontinence and urinary urgency. In such conditions, this combination can be used. But when we are using two different drugs, we can expect different types of adverse effects and precautions. So today in this video, we are going to see how this combination works in BPH, what are the important precautions that should be considered, what are the side effects, and what is the dosage. All these things we will discuss in this video. First of all, let us see how this combination acts. This combination is having two drugs. One is Dutasteride and second one is Tamsulosin. Normally, the prostate size is controlled by few of the hormones like testosterone. This testosterone should be converted into its active form by reduction. So it is going to be converted into dihydrotestosterone by reduction process. For this reduction, one of the enzyme is required, that is 5-alpha reductase enzyme. Now, testosterone can be converted into dihydrotestosterone, which is the active form of testosterone. This DHT can produce its androgenic effects on different parts of the body, and here at the prostate capsule it can increase the prostate size. Now Dutasteride is one of the 5-alpha reductase inhibitor. It can selectively block this 5-alpha reductase enzyme so that it can inhibit the conversion of testosterone into dihydrotestosterone. So the levels of DHT are reduced, which reduce the prostate enlargement and even it reduces the prostate size. In this way, Dutasteride mainly relieves the symptoms by reducing the prostate size. But the Tamsulosin works by different mechanism. In the men with prostate enlargement, we can observe the enlarged prostate can put some pressure on the bladder neck, which increase the urinary urgency. So people may have urinary urgency, urinary frequency, but they may have weak stream of urine because the urethral pathway is somewhat blocked. Now urine cannot be flow freely through the urethra because of blocked pathway. This condition can be corrected by Tamsulosin. Tamsulosin can act on the bladder neck muscles which produce a relaxation so that it can reduce the urinary urgency. Similarly, it can act on the urethral smooth muscles where it can increase the urethral pathway so that urine can be freely passed out of the urethra. In this way, Tamsulosin mainly increases urinary flow, thereby it can reduce the symptoms of BPH. Now this combination can effectively work to reduce the symptoms of BPH. Dutasteride can reduce the prostate size and Tamsulosin can increase the urinary flow. Finally, this combination can relieve the symptoms of BPH. Now let us the precautions of this combination. Precautions of this combination may be related with each individual drug in this combination. For instance, Tamsulosin is one of the alpha-1A blocker, and when this medication is used, it can produce some orthostatic hypotension because of vasodilatory response. So with use of Tamsulosin, patient may observe some dizziness, lightheadedness, symptoms of vertigo, some tinnitus, buzzing noise in the ears, even a state of confusion may be produced. In few of the people, it can produce some syncope resulting in falling sensation. All these symptoms can be produced because of Tamsulosin due to its vasodilatory effects. That's why when this combination is particularly used, the patient may have lightheadedness during the early days of therapy. So caution should be taken while involving those activities which requires high attention. Apart from this, few of the drugs like alpha-1 blockers can further increase the orthostatic hypotension. These alpha-1 blockers can be used for the management of hypertension. For instance, drugs like prazosin, doxazosin, Teratogenic, all these drugs are the alpha-1 blockers. They can reduce the blood pressure when they are combined with Tamsulosin. So these drugs should be carefully combined along with Tamsulosin and Dutasteride combination. Another important precaution is with PDE5 inhibitors, phosphodiesterase type 5 inhibitors. So drugs like sildenafil, tadalafil, vardenafil, all these drugs ending with the suffix -afil, they are phosphodiesterase type 5 inhibitors. These drugs can be used for the management of erectile dysfunction, but they should be carefully combined with Tamsulosin. Generally, Tamsulosin is contraindicated with phosphodiesterase type 5 inhibitors because this combination can produce a severe hypotension that may lead to dizziness and lightheadedness. But in this combination, Tamsulosin is used at low dose such as 0.4 mg, but still it can produce significant interaction with phosphodiesterase type 5 inhibitors. So this combination should be carefully used with PD type 5 inhibitors. And even Tamsulosin can produce few of the effects on ejaculation, and it can produce one of the condition priapism, which lead to painful erection as well as long time erection. This painful erection can further complicate erectile dysfunction. That's why preferably Tamsulosin should not be combined with phosphodiesterase type 5 inhibitors. Another important precaution is with the Dutasteride. Dutasteride should be carefully given in the people who are having increased risk of prostate cancer, because Dutasteride can induce the prostate cancer in such people. So care should be taken to check any development of prostate cancer. In the people with prostate cancer, PSA levels, prostate specific antigen levels are elevated, which is a good indicator of prostate cancer. But interestingly, Dutasteride can have an opposite effect. With use of Dutasteride, the PSA levels are reduced, which may mask the induction of prostate cancer in the people. That's why during the therapy with Dutasteride, at least up to 3 weeks, the PSA level should be checked and the base levels of PSA should be recorded. Any elevation of PSA levels above this base level may indicate the development of prostate cancer in the people. So Dutasteride masks the prostate cancer, but after 3 months, any slight elevation of PSA levels may indicate the development of prostate cancer in the people. Another precaution is with the Tamsulosin. Tamsulosin is metabolized within the liver and it is going to be converted into metabolites which are somewhat less active. One of the important group of enzymes responsible for metabolism of Tamsulosin is the CYP3A4, cytochrome P450-3A4. Many of the drugs can affect this enzyme activity. For instance, strong CYP3A4 inhibitors can block this enzyme activity, which reduce the metabolism of Tamsulosin. So Tamsulosin levels are increased within the body, which increases orthostatic hypotension. This may result in symptoms like dizziness, lightheadedness, and hypotension. So strong CYP3A4 inhibitors like ketoconazole should be contraindicated with Tamsulosin because it produces very severe orthostatic hypotension. Finally, we have another precaution with Dutasteride. This drug can affect the pregnant woman and it is teratogenic in nature. That's why in the pregnant woman, dutasteride should not be given. So this combination should not be given in the pregnant woman as it contains dutasteride. Another important thing is that dutasteride can enter through the skin, and because of this transdermal permeation of this drug, so care should be taken in the handling of tablet by pregnant women or women liable to be pregnant. But here in this combination, tamsulosin and dutasteride is available as a capsule. This capsule should not be crushed or opened by pregnant women because it can increase the systemic exposure and damage to the fetus. What is the side effects of this combination? The side effects may be related with each component in this combination. Dutasteride mainly produces few of the side effects like impotence, loss of libido, sexual desire, breast tenderness, breast enlargement. All these side effects are observed with dutasteride due to its steroidal effects. Tamsulosin can produce few of the side effects like dizziness, lightheadedness and hypotension. Even it can produce some abnormal ejaculation, priapism, prolonged erection, which results in the difficulty in ejaculation. So these are the side effects that can be observed with this combination. How it is given? This combination is available as a capsule, and each capsule contains two drugs. One is dutasteride and another one is tamsulosin. Dutasteride is available at a strength of 0.5 mg, whereas tamsulosin at 0.4 mg. The dose of this combination is given as one capsule once daily, and it can be given after the meal in order to produce better therapeutic efficacy. But at the same time should be maintained on each day. So that's all about this combination, dutasteride and tamsulosin. Hope you like this video. If you really enjoy this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.